I just want to introduce the MSBase project to you. MSBase is a registry, an MS registry, that collects information on how people with MS are doing, both in terms of disability outcomes, in terms of attacks, and the medications that they take, pregnancies, really the journey, if you like, of MS over the long term. It's an international project. It started in 2004 and it's been really very successful. The way the data is collected is really from neurological practices. So these are essentially MS specialist centers with neurologists that take care of people with MS, and they provide this data, of course, in a standardized format so that it can all be combined and analyzed all together. The idea really is to work out whether MS is different in different parts of the world, and also to understand how the medications that are used for MS actually work in the long term. We do know that they cut down relapses, we do know that they cut down MS lesions, but what impact does that have on disability, on preventing disability over 5 or 10 or more years? So we've been doing lots of this work, particularly in the last couple of years, as the data sets, if you like, the observation period of the people with MS in a system is now relatively long. So once you have 5 or 6 or 7 years of data, you can actually answer some of these questions. Just by way of example, we've shown that if you look at MS outcomes, that the medications that were used for a long time in MS, the injectable medications, interferon and Copaxone, seem to have a very significant effect on reducing disability in the long term. So injecting yourself does in fact reduce the odds of becoming progressive, of accumulating more disability. And that's important to show because it provides, I guess, the extra motivation to keep going. The other thing that's really important is, as I'm sure you know, there are lots and lots of MS medications available now, but how they should be used, in what sequence, and which drug is best for which person is largely unknown, actually. So these datasets, again, can try to answer some of these crucial questions. And I think in the next few days you'll hear from some of the people who are doing this kind of MS-based work about their specific projects and how the data is being utilized. Now, at the moment, it's neurologists entering these data. We've recently expanded the project to include nurses and scientists, but we're seriously thinking about how to directly interact with people with MS. That's a challenge over the next couple of years as to what information we might be able to collect and what information might be of interest to people with MS, but it's definitely one of the ways in which we want to go in the future. You can check out the project. Quite a lot of the work is actually available on the web at www.msbase.org. Thank you.